The root of an eyelash looks like this under a microscope, and beside it is Demodex follicularum, one of the 2 species of mites that mostly live in hair follicles and oil glands. These mites are associated with eyelid margin diseases such as Demodex Blepharitis and Meibomian Gland Dysfunction. The eyelid margin has long been an underestimated structure as far as ocular surface health and dry eye are concerned. Not anymore. Thanks to a consensus group from the Intrepid Eye Society that put together an eyelid margin health approach in addressing both Demodex Blepharitis and MGD, the faculty's consensus on eyelid margin health, published in this Cookie Magazine supplement, hopes to raise awareness and promote increased frequency of screening for improved patient outcomes.
Hello, I'm Dr. Selina McGee, President of the Intrepid Eye Society, here today to talk about eyelid margin health.
And I'm Dr. Mark Schaeffer. Today we're behind the scenes filming a series of additional educational videos that complement the consensus statement on Demodex Blepharitis and Meibomian Gland Dysfunction published in Cookie.
By surveying the expert faculty members of the Intrepid Eye Society, we identified the best practices for managing eyelid margin health in practice.
What percentage of your patients has collarettes on their lids or lashes? And 17% said 41 to 60%, 83% said 21 to 40%. Now, Selina, let me ask you a question. How do you check for collarettes in your patients?
It's really simple, actually. So I just have my patients look down and take a good close look at the base of the lashes. It's really that simple. When you see a collarette, that's pathognomonic for Demodex Blepharitis.
I've been really surprised too at the number just by doing that. A simple, easy look down with the slit lamp has really generated a lot more patients that I thought didn't even have Demodex before then.
What percentage of all your patients has Meibomian gland dysfunction? That's what we're looking at here. So 50% said 81 to 100%. 33% said 61 to 80%, and 17% said 21 to 40%. So Mark, when you're looking at patients, how do you evaluate for Meibomian gland function?
So the exact opposite of Demodex Blepharitis, where they look down, I'm having them look up, and I'm actually physically pressing on the Meibomian gland. So I like to press in the center of both eyelids and see what comes out. I think that's the best way for us to really determine if there is Meibomian gland dysfunction, is actually pressing on those lids. I'm always surprised at the number of patients who tell me no one's ever done that before, but then we can connect some of the symptoms that they're having.
I love that. And one thing that I've learned, because I have meibography in our practice, it's sometimes tempting to just look at the meibography and look at structure, but unless you push, you're not going to know what's happening. And I've had lots of patients with non-obvious Meibomian gland dysfunction, meaning they have perfect glands when you look at them structurally, but when you push, nothing's happening.
How significant do you find the impact of Demodex Blepharitis and Meibomian gland dysfunction on patient satisfaction and visual outcomes in your practice? And what we see here is that 83% said very significant, with 17% saying moderately significant. And what I'm seeing in my practice is really like this. And the thing that I've really noticed is that patients don't know that they're having visual outcome issues until we determine that for them. And a lot of times it starts with the phoropter. Behind that first, which is better, 1 or 2, if your patient has to blink in order to see things clearly, I'm done with my exam. I know they have Meibomian gland dysfunction. It's just a matter of proving it and then connecting the dots to them to help them understand why their vision may feel blurry to them.
When you diagnose a patient with Demodex Blepharitis and or Meibomian gland dysfunction, it does affect their vision. And when we look at, to Mark's point, talking about their visual acuity and getting behind the phoropter, I think that's a really great pearl. And patients don't connect the dots, to your point. When they come in complaining their eyes are itchy, I always make them show me, like show me where it itches. If it's in the corner and they're rubbing like this, that could be allergic conjunctivitis. But when they very indicatively, do this, that's telling me that we've got Demodex Blepharitis. And then we're pushing on glands to identify Meibomian gland dysfunction. But remember that the tear film is the first interface for refraction. That's how this affects our patient's visual quality. So if they have Meibomian gland dysfunction and or Demodex Blepharitis, their vision is going to be compromised because that tear film quality is not pristine.
And that's just at the glasses, right? Think about contact lenses as well, which is one of the reasons patients come and see me every single day, is they want to wear their contact lenses. But if they're having a breakdown in their meibomian glands or showing signs of Demodex blepharitis, it can affect their tolerance level for contact lenses, which affects their vision. So now they can't wear them as long, they don't feel like they're working as well, and we start to see this like patient experience where they stop wearing their lenses or they don't wear them as much, and they're not satisfied with their outcomes either.
You know, one of the things that's really important that Mark just shared about patients will decrease their wear time, patients will sometimes drop out of contact lenses altogether, which is really unfortunate. And we have so many good technologies with contact lenses and solutions that I think sometimes we are excited, oh, we can just try a new contact lens. But if we don't take a step back and look at the ocular health and look at the eyelid health, we're missing a very big piece of that puzzle that won't matter what the contact lens technology we're utilizing is. So he brings up a really good point that we need to start with the eyelid health and look at what's going on with the eyelids and lashes. Do they have Demodex blepharitis? And then pushing on glands, do they have Meibomian gland dysfunction before we leap to the new technology with contact lenses?
So the impact for glasses wearers, it's still there because they're gonna notice that their vision isn't clear. They're gonna come in saying their vision isn't blurry. When we refract them, their numbers are gonna look the same, and we're gonna go, well, it's the same. And it's really easy for us to push more minus or add more plus to our presbyopes and actually push them out of comfortable wearing with their glasses, where all we needed to do was make that vision clearer and more stable, because the vision happens between those blinks, and that's when the patients are feeling it, where when they're fluctuating vision or they notice that it comes and goes, and if they blink, it's much better. Those are signs for me that this is not the glasses' fault, but it's the surface itself. To contact lenses as well, I think one of the things that we always need to mention is that all of these materials are built upon the fact and assuming an intact corneal surface, an intact tear surface. And if you break that down, all of the optics in the world can't correct for that, can't overcompensate. So we have to make sure that these lenses are going on appropriately healthy eyes.
When patients have Demodex blepharitis and or Meibomian gland dysfunction, they can very much affect how their eyes look and certainly how they feel. But patients are concerned when they look in the mirror and they see that their eyes are red. And often I have patients that come in and they're like, they say my eyes are red. I'm like, tell me more, like, what do you mean by that? Because sometimes we think that it's, okay, their eyes, like the white part of their eye is red, it's the conj, and actually they're talking about their eyelids that are red. And we know with Demodex blepharitis and Meibomian gland dysfunction, it does change the way that things look, and patients are very concerned about that. And because they don't feel as good as they want, they don't look as good as they want, that very much affects their quality of life.
I think the flip side to that is actually the patients that don't know any better. And I think that's the really interesting part that we've seen over our years of actually treating this earlier and earlier, is that we have patients that didn't know this was the way their eyes were supposed to feel like. So after treating the Demodex, after treating the Meibomian gland dysfunction, we can see them going, wow, this is so much better. I didn't realize what I was missing. So our patients don't necessarily connect the dots either because they don't know what they don't know.
One thing that patients will also do is with Demodex blepharitis, they may have thinning eyelashes, their eyelashes may start to be misdirected. There's certainly a different look to their eyelashes, and sometimes they'll do drastic things trying to improve the look of their lashes, and it just compounds the problem. So having an intentional conversation around that, I think, is really helpful for patients because they're just trying to fix a problem they don't even know they have.
And then understanding the fact that, like, I get the irony of me explaining eyelashes and extensions and eyelash serums to patients. Like, I have patients that have been putting on eye makeup longer than I've been alive. But it's important to break that ice and understand that we're coming from a place of trying to get their eyes as healthy as possible and trying to do what's best for them, while still being able for them to live the lifestyle that they want. So meeting them kind of in the middle of like, listen, you can do the things that you want to do, but you just have some things that we absolutely cannot do with your eye makeup, lash extensions, etc., and we can make you better.
How significantly does the lack of awareness about eyelid margin health among the general population contribute to the underdiagnosis of Demodex blepharitis and Meibomian gland dysfunction? And what we saw was 83% said significantly, and 17% said very significantly. So what does that mean to you from an education standpoint when there's this lack of awareness of what's really happening?
Yeah, a lot of it for me is just breaking down that ice, right? It's breaking the ice so that we can explain it to the patient, but doing so in normal terminology. And I think it's important for us so that we can speak the patient's language without scaring them. But we need to tell them what's going on because it's an eye condition that's going to affect the way that they live their life. So being able to use specific terms, but also being able to use very generic terms at the same time and working on that. Like, it is a workshop class that we have continued to workshop as we've seen Demodex Blepharitis and diagnosis and treatments get better, but also with Meibomian gland dysfunction. But again, it's connecting the dots for these patients so they become aware, but also normalizing the condition because it is so ubiquitous.
And it's really important that patients understand that it's not something that they did to get this, right? This is something that is the most common ectoparasite on the body. Everybody has this, has been exposed to it. It's not anything they did. They're not contagious. Those are things that patients always ask, and you can kind of see that like fear rise. And so I always level set that right from the beginning and reassure them this is not about hygiene. This is your body's just lost its homeostasis and its uncontrollable growth of this mite. And good news, I have a way to manage it and fix it for them.
Yeah, I think that's really important. Again, having that ability to level set and just set their expectations of, I like to tell patients, it's not contagious, it's not related to hygiene, and you don't need to burn your sheets and towels. And then always, again, humor usually gets them to lighten up and just take a breath. It's always fun when spouses are in the room and they're like, you gave me what? Right? And that's something that we always want to be mindful of is delivering that news. But again, having treatments that are effective and having treatments that do create a better environment for the eye, it allows for us to have that conversation with more confidence and more competence. What type of patient should you be performing eyelid margin health screening on? And all of the panelists said 100% all patients, regardless of patient complaints. And I think that's part of what we do as optometrists. It's our job to do a comprehensive evaluation of the eye and adnexa, and part of that is the eyelid and eyelid margin. So for us, being able to functionally look and structurally look at the eyelids and eyelashes, it's paramount to what we do. We talked about its effect on the visual aspect. It's talked about the contact lens aspect, the post-operative context that we have as well. We know that it affects outcomes. So what can we do to help generate better outcomes for our patients who, when they come in, their biggest complaint is, I want to see better and I want to feel better. It starts with the eyelids and the eyelashes, and it's really easy, and again, does not take a lot of time to implement. It's looking down in the slit lamp and shining your flashlight beam, and then it's looking up and pressing for less than 3 seconds. All of that takes very minimal time, and again, delivers results to patients that can give us better outcomes for all of these therapies.
And remember the anatomy and physiology, what's really happening on this whole process. You know, historically, we started at the tear film to assess what's happening with the tear film. But when you back up a moment and look at, okay, what's the function of the eyelids? Why do they exist? They're a protective mechanism to move the tear film across the front surface. And our blink starts with the orbicularis oculi. And when that blink starts, it finishes with the muscle of Ryland pushing meibum onto the front surface, right? So if we don't assess the blink, if we don't assess, is there inflammation happening on the eyelids that ultimately affects what's happening on the ocular surface, we're missing half of the story. And so I think it's just, we know more now, and we know to start with the eyelids, look at what's happening there to further assess what's fully happening with the tear film at the corneal surface.
I think it also allows you to meet problems before they happen. And part of that is we need to be proactive with this. So again, looking at contact lens wearers, glasses wearers, can we anticipate problems with remakes, with contact lens checks, with contact lens dropouts? All of that is related to the surface of the tears. Again, everything's dependent upon a perfectly intact cornea, and that starts with the tear film. So if we don't have a tear film that's working well, we're going to see suboptimal results, and that's going to ultimately affect your patient's experience and your experience as a doctor.
I've been interested also, like sometimes if I have a patient that I've diagnosed with ocular surface disease, we're going through their journey and they should just be getting better and they're not. That's when I pause and go, okay, what did I miss? I missed something. And before I was diligent about having patients look down and I was diligent about pushing on glands, often it was because I missed something with the eyelid and they had Demodex Blepharitis that I didn't diagnose. So I think that's always important too for us to pause and take a step back and go, what did I miss? This series of videos complements the full supplement, available to download and read at the link in the caption.
Each one dives into a different topic with different KOLs, so stay tuned to the Fundingsland Group for updates.